Good. Good. Focus on that hand holding on to me. Good. There we go. Hey, good morning everybody. It's Dr. Warren here at Kalkstein Chiropractic in Towson, Maryland. Today we've got Nathan with us. Nathan comes in every 3-4 months just for a tune-up adjustment. And today's visit he came in. When did the pain in the back start?
About a week ago.
So I'm going to have him describe his symptoms, and just remember, sometimes people get really wigged out by rib pain, or pain that occurs from a rib because it can travel around the front of the chest. It can be really, really intense. Breathing is hard, right?
Yep.
Every time. So yeah, explain some of your symptoms that you've got.
Feels like you're sleeping on a rock.
Yeah.
And it feels just like it's just jammed in the back there, next to the shoulder blade. And this one's on the left side.
So when you sleep at night, do you notice the discomfort on a particular side, or is it on both sides?
Just on the left side, right here.
That's common with rib pain. So when you lie on the same side as the discomfort that you're having, increased symptoms. So for people that are trying to gain a better understanding of where maybe their symptoms, and it can last like 6 weeks. Ribs can be a little finicky that way. So laying on the same side as the side of pain at night causes discomfort. So overhead activities are like a lot of push-ups. Like say you do like 300 push-ups, one of your workouts, you're just crushing your push-ups, and you're not used to doing that many. You haven't built up that strength or good form to do that. What happens is your back takes a lot of stress, and your scapula is sitting there trying to stabilize through all those push-ups. Doesn't do a great job. It requires more movement and stability from these ribs than they can handle, and then you get a rib spasm, you get irritation around a rib joint. That can refer pain all the way to the front of the chest. It can last a long time. So what do I do? How do I treat this type of problem? First, a good history to make sure that I'm dealing with it. When I palpate a rib, it's pretty easy. You go to see your chiropractor, your physical therapist, and that's good with manual work. When they go down your back, they'll find it pretty quick, and you'll know that they find it pretty quickly. So right when I wasn't even pressing on him, he's like, yeah, you're on it right away. So soft tissue work around the head of the rib. I'm just doing some gentle cross friction around the rectus spinae because he's just guarding a lot. I'm just waiting for him to relax a little bit more under my hands. At home, say if he gave me a phone call and I knew it was rib irritation, right, I would tell him, pull out some heat. That's really helpful for these. Avoid movements that are irritating. That's the biggest one. So giving your body the time and the rest to heal from this problem. If you're doing like a ton of high intensity exercise, or you're a heavy lifter, so if you're choosing to do those activities right through physical exercise, give yourself a little rest with it. Try something different during that time. Okay, I'm going to adjust you down here first, okay?
Okay.
Take a breath in. Easy exhale. And then getting a foam roller, right? Foam rolling out the mid-back, and then following it up with some active stretches. Cat-cow is a great way to get good movement. Breathe in for me here. Exhale, easy. So the intercostal muscles are in charge of the exhale, right? Breathe in. And really breathe out, let go. Good, and just pressure here. Good. Good. So I'm working above and below that joint that's really irritated. Doing good?
Yeah.
Breathe in for me. Easy. There's pressure. You feel movement across, let it drop here. Good.
Oh.
Good.
Yeah.
Really relax. Loosen all the way through. Good job. So that's just a CT junction first rib adjustment when they're prone. It's really comfortable, especially when he relaxes as much as he did. I'm going to do a little soft tissue work over the area that he's got that discomfort, and then I'm going to adjust it. Doing well so far?
Yeah.
I'll have you sit over here, Nathan.
Alright.
Take your time getting there, brother. So these are conservative ways of dealing with it, right? Soft tissue work around the rib. So at home you can do that foam rolling, and we'll show you what we mean by that today, okay? Bring your head back for me. Good, now just rest there. You're gonna bring your chin straight down to your chest. So I'm doing a pin and stretch technique on his levator scap, and then I'm scooting down towards his erector spinae group and just getting the muscles to relax. Turn your head to your right. Good, tuck your chin. So I work around the scapula when these problems present, because if I don't, if I only adjust the rib, it comes back pretty quickly. So, and if I don't adjust the rib, then the pain is still there. Head back for me. So combining some soft tissue work around the scapula, head down, as well as making sure that the complex is moving well in general. So I'm going to work to some of the areas that tend to get a little tight on people, into the upper back. And I'm also going to make sure that his pec isn't hypertonic, isn't really tight and pull forward. Getting that to open up will take some stress off his upper back. So we have a Rolfer on staff. She is fantastic. Bring your head back for me. Rolfing is a form of soft tissue work. It's a different approach to massage. Head straight down. Turn your head to your right. Good, tuck your chin. And Laura, who works here, has worked here for 15 years, bring your head back, head down, is really, really good. And so I pick up tips from her as well when it comes to different types of soft tissue work. Like, there's a lot of approaches to dealing with a movement issue, right? So my clinical understanding from chiropractic school allows me to diagnose and treat properly, and then I can apply different manual techniques from a lot of different professions that say that it's their way of doing it, right? Head to your right. Know what I'm saying, Liam?
Mm-hmm.
Know what I'm talking about?
Mm-hmm.
Okay, bring your head back. Liam knows what's up. Now bring your head down. Reach across. Right there. It's gonna be a little tender in here.
Yeah.
So I'm going to the rhomboids, right outside where that rib is irritated. Rhomboids. Tuck your chin. There you go. Turn your head to your right. Breathe. Don't fall into that. Let go. Let go of all this tension. There you go, brother. Good. All right, come up on your back.
All right.
Doing well.
Wow, that was tight.
The tight underneath my thumb where I was
It
pressing.
was very tight.
So it's tight there, right? But I just realized too that I'm also creating tension at that level with the movements that we're doing, right? Bend your elbow for me, brother. Good. Here. Good. Excuse me, Liam. Relax. Bend your elbow. Good. Yeah, just comparing side to side. He's a little tighter here, so his ability to go back is decreased compared side to side. So there's a really easy way to stretch the pec. Push your elbow up into a hand. Just focus on that point of the elbow.
Okay.
Go ahead, push. There you go. Hold for 4, 3, 2, 1. Now relax.
Okay.
Push up. The PIR is like a really easy way to see how we guard in certain positions, or how our muscles tend to tense up certain patterns. So, I just got another 4 inches relax out of his shoulder going backwards because his pec is just letting go a little bit more. Reinforcing that with movement is really important. It's not all about just stretching the tissue. Push up. So, come on. There you go. And let go. All right. Good. All right, hang tight. So this is the first rib adjustment, but I can also go down lower to the T3, T4 region where he's got a little irritation. I let his head go into extension. Turn your head to your right for me. Good. Rest your hand right here. Reach across. Hold with that opposite hand. All right. As comfortable as you are right now, just relax back when I bring you here. I know it's gonna feel a little tense underneath my hand, but just don't tighten up. Good. Take a breath in. Now relax, exhale. Just focus on that hand holding on to me. Good. There we go.
Thank you.
You're welcome, brother.
Oh man, I need that.
I like you saying brother. See my ginger brother. You needed that. I know you're hurting. It's not a fun discomfort to have. Ribs are the worst up there, I would say. And there's ways to deal with them. Also, there's a lot of fear around ribs that I get when people come in. Like some people almost have anxiety attacks around it because it's so intense. If you're moving around and it's getting irritated, think musculoskeletal, think movement, musculoskeletal pain, right? And then if you can find a comfortable position, right, and it goes away, that's like you're decreasing tension on an area that's irritated. If that gives you some peace of mind, if you have some irritation somewhere. So we'll teach you how to foam roll.
Thank you.
Heat at home, yeah, you're welcome. And then cat camels, like flexion extension exercise for that area. Another thing with ribs, don't stop breathing. Take deep breaths in and out. You're gonna feel tense when you do it, especially in the morning when you wake up and at night when you go to bed. Just breathe through it, okay? Don't hold up. Don't allow that rib to kind of boss you around.
All right.
Breathe into it, move into it, and then we'll start to let go. Stretch your pecs. Cool.
Thank you.
You're welcome, man. It's good seeing you.
Appreciate it.
Absolutely.